No Tobacco Month on the eve of World No Tobacco Day. On the occasion of World No Tobacco Day, it is important to highlight the harmful effects of smoking, not only on smokers, but also on those who are exposed to second-hand smoke. Second-hand smoke is more harmful to non-smokers than to the one smoking. How, you may ask? Poets and filmmakers have described smoking in many ways, but doctors have always warned that smoking is harmful. The government has also imposed several restrictions on smoking. Since second-hand smoke is more harmful to non-smokers than to smokers themselves, many actions have been taken, including banning smoking in public places such as bus stands, schools, hospitals, cinemas, and more. Smoking increases the risk of life-threatening diseases like lung cancer, yet from young people to adults, many continue to waste money and damage their health by smoking cigarettes, cigars, and bidis. What starts as a casual habit soon turns into an addiction. People who smoke stylishly, blowing rings of smoke, are actually burning their own lives. It is not just adults, even children are facing lung problems because of it. Due to second-hand smoke, the number of children suffering from asthma is increasing every day. Smoking also leads to diseases like pneumonia or pulmonary bronchitis, which cause coughing and breathing problems. Children living in homes where people smoke are more likely to develop lung issues. Smoking weakens their immune systems, making them more prone to illness, and these children often appear weak. The World Health Organization has issued a warning stating that by the end of the 21st century, around 62 million people will lose their lives due to tobacco use. In developed countries, the WHO estimates that 1 in every 6 deaths is caused by tobacco. Smoking among women is increasing, with many taking it up as a fashion trend. The WHO has expressed concern that this number may continue to rise. There is a need for awareness on this issue. Rural doctors should educate people about the dangers of tobacco, as statistics show that 1 person dies every 8 minutes due to tobacco-related diseases. Dr. O. Nageshwara Rao says that in India, 1 million people die every year because of tobacco use, and smokers lose around 10 years of their life expectancy. Doctors in rural areas need to educate people about the harmful effects of tobacco. Different types of pollution are harming people's health, and smoke is one of the biggest causes. Cigarette smoke is especially dangerous. It is estimated that over 10 million cigarettes are smoked every minute worldwide, adding up to 1,440 crore cigarettes smoked each day. Cigarettes contain over 7,000 harmful chemicals, including dangerous substances like nicotine and benzene. Not only cigarettes, bidis, and cigars, but also tobacco-related products like gutka and zarda are severely damaging public health. Every year, 5 million people worldwide die from tobacco-related diseases. Studies suggest that if this habit continues, by 2030, over 8 million people could die each year due to tobacco. In India, 33% of population uses tobacco, according to the Healthcare Foundation. Millions of people suffer from tobacco-related diseases, and thousands of crores of rupees are spent each year on treatment. Even if people do not directly use tobacco, those who inhale second-hand smoke also suffer from its harmful effects. This means that many innocent people in the country are paying the price for someone else's bad habit. Adults and youth, who should be role models for children, need to be cautious about tobacco addiction to protect the future of society. What begins as a casual cigarette habit slowly grows in importance, especially among young people, where smoking has become a status symbol and style. You might wonder why we are talking about cigarettes now. It is because May 31st is World No Tobacco Day, a day dedicated to fighting against tobacco use. Tobacco causes many harmful effects. Smoking leads to heart and lung diseases, along with cancers such as lung cancer, diabetes, and kidney cancer. Smoking is also a cause of asthma. Every 8 seconds, someone dies because of smoking, and millions of people die each year due to this habit. Additionally, gutka, which contains tobacco, can also be life-threatening. To raise awareness about diseases caused by tobacco, World No Tobacco Day is observed every year on May 31st. In this context, Dr. Rao's Oral Health Foundation in Hyderabad organizes month-long awareness programs from May 1st to May 31st every year. The main goal of these programs is to educate people about the dangers of smoking. Across the Telugu states, meetings, rallies, and seminars are conducted to inform the public about the harm caused by tobacco, says Dr. OGURI NAGESWARA RAO, the founder of Dr. Rao's Oral Health Foundation. Smoking has now become a fashion trend, but it severely affects children in households where adults smoke. Dr. Nageshwar Rao also mentions that second-hand smoke impacts the health of those around smokers even more than it does the smokers themselves. Tobacco use has deeply penetrated society in many forms. Young people use cigarettes, scholars use snuff, the wealthy use tobacco in pan and zarda, and common people consume bidis and hand-rolled cigarettes. With the easy availability of these products, additional forms like kayani, gutka, and zarda have become widely used, especially in rural areas. In these areas, rural women use rolled cigarettes holding the burning end in their mouths, which often leads to oral cancer. Tobacco also causes tuberculosis and other severe health issues. Each year, tobacco causes 1 million deaths due to oral cancer, dental issues, tuberculosis, lung cancer, stomach disorders, mouth sores, ulcers, gas trouble, and stomach cancer. Although products like cigarettes, bidis, and hand-rolled cigarettes provide temporary pleasure, they largely contribute to poor health. Tobacco products need to be fully banned as they lead to heart disease, blood clotting, stroke, and lung cancer. In this context, the Supreme Court's decision to require warning images such as skulls, cancer pictures, or similar warnings on cigarette and bidi packs is commendable. But at the root of this problem are farmers who work hard to produce tobacco that eventually harms people. Isn't it better for farmers to focus on crops that promote health and well-being instead of tobacco? Farmers should consider the responsibility they hold in protecting public health by choosing crops that contribute to people's welfare. The government should act immediately. Tobacco, which works as a slow poison affecting millions, needs to be gradually banned, similar to how marijuana was outlawed. Alternative arrangements and support should be provided to farmers who grow tobacco, encouraging them to switch to other commercial crops. Programs to ensure a livelihood for workers dependent on the tobacco industry should also be implemented, and media should be fully utilized to spread awareness on this issue. The goal should be to move away from financial profits from tobacco and instead focus on public health. A healthy population leads to a prosperous and developed nation. Dr. Rao's Oral Health Foundation, Dr. O.N. Rao Charitable Trust, all wish for people to live healthy, happy, and prosperous lives.